Welcome back. It's time for your health segment, and this evening we are focusing on reproductive health care, particularly among the youth. Of course, the Constitution defines youth as between 18 to 35. So we are just going to look at, in terms of access, how accessible services for the youth, reproductive health care services. And for more insights, I'm now joined by David Rasheed, who is a champion for youth reproductive health care. Currently, they're running a campaign dubbed Sauti Sasa campaign, of course, just seeking to create a lot of awareness regarding reproductive health care and the youth. Thank you for joining us this evening, David.
Thank you very much for having me. Absolutely honored to be here.
Good. Let's talk about the status of access to reproductive health care for youth today. What do the numbers look like?
So unfortunately, it's not very easy to talk about the numbers in terms of access, but we can talk about reality that we see on the ground every day that we're interacting with young people. For instance, we still do not have quality, affordable and accessible youth-friendly services for young people out there. And so that really limits the healthcare, the quality of healthcare that young people are getting. So young people cannot access contraceptives effectively, and even just freely is one of the things that we talk about. Young people cannot even access something as basic as HIV services and all the other myriad.
Is it access because they don't know, the facilities are not there, or access because of the stigma that goes around it?
I would take it from the angle of the stigma that goes around it. As I mentioned, the thing is around youth-friendly service delivery. And so yes, we have healthcare centers that are providing these services for the general population, but then young people are, we'd call it a unique society or group of people. And so there's something that we term as youth-friendly services, and so that's not a reality in the country at the moment. And so what we find, even as champions for reproductive health, is we can talk about accessing the services, and you can ask young people, go to your nearest healthcare center to access it. But then the feedback we get is that I went there, but they're not receptive to me. They actually shunned me away.
So what would constitute a youth-friendly service in your opinion?
I mean, youth-friendly service is about number one, being able to understand the young person, not only from a health perspective, but from a personal perspective. This is a young person. They have this different things that they're going through. Other than just their health, they're thinking about probably internet bundles for Facebook and Instagram, They're thinking about how they can hang out as youth in a very safe space where they can be able to talk. So that is, just some of the qualities we look at when we're looking at into youth-friendly service delivery, and also the whole aspect of it being a one-stop shop, in that if I go to this place, this center that we dub as a youth-friendly service center, then I can get all the services that I'm looking for. If I want to talk to a counselor, it's easily accessible. If I want to have HIV tests, to access contraceptives, to access even something as basic as a pregnancy test, it's not something that I'm bad to doing so. Yeah.
Perhaps what are some of the evolving challenges that the youth are facing when it comes to dealing with reproductive health care?
Yeah, that's a very good question. And again, just to look at it from the other end, we are providing curative measures for young people, but not the preventive. So the numbers we're currently looking at is, for instance, when we talk about HIV, young people between the ages of 15 to 24 currently are the ones contributing to 51% of all new HIV infections. That's around 48 young people every day. That actually translates to 2 young people every hour. So if you do the news from 9 to 10 p.m., that's 2 young people getting infected. If we talk about teenage pregnancies, which is a huge focus for us in this campaign, in the years between June 2016 and July 2017, UNFPA reported around 378,000 young girls getting pregnant, teenage pregnancies.
So the numbers are growing. What has this been attributed?
It's actually worse. The preliminary numbers we're getting from the Ministry of Health at the moment are saying that in 2018, a year later, the number is now looking at 500,000 teenage girls getting pregnant. Annually. That's now, the first one was from 2016 to 2017. Now the one we're looking at is from 2017 to 2018 from the Ministry of Health itself. And it's looking at 500,000. And those are the ones that have actually been reported.
So what are you attributing this increase to?
It's actually a number of factors that we can look into. Number one, starting from the individual perspective, it's young people actually don't have the comprehensive information to be able to take care of themselves. And so what we find even when we do our community engagement is that there's this basic knowledge. Yes, we know about HIV. Yes, we know about, you know, sex and you know what happens when you have sex. Yes, we know about pregnancy. But then when it comes to the comprehensive knowledge about it, you know, do you know how you can actually contract HIV and how you cannot? Do you know how you can protect yourselves from contracting HIV and pregnancies and STIs? Then that knowledge does not exist.
They're more scared of getting pregnant than actually getting diseases.
It's a very funny fact when you think about it, because so the idea is, although it's sort of like a conflicting thought.
Yes.
Young people are afraid of getting pregnant than getting HIV because pregnancy is
evidence.
It's evidence. Like you walk around with the evidence that this person has been doing something. However, on the other hand, when you look at the numbers, you know, it's sort of conflicting on that end. Then we look at the community. What we have in the community, I look at it in two perspectives. Number one, community and community gatekeepers such as parents, teachers, religious leaders, you know, the village elders have refused to allow a space where a dialogue can be heard about sexual reproductive health and rights.
It's always been considered taboo, you know, culturally.
It's always been considered a taboo. So on one end, we're saying, oh, these young people, you know, the things they're watching nowadays are bad and this is why they're engaging in this conversation, I mean, in these actions. But then when you now try to, you know, look for ways in which to penetrate the community and have these conversations, then they shun away from that conversation. No, we cannot be telling our children about sex.
So how do we get them to stop burying their heads in the sand?
I mean, number one, it's definitely something like this. If we are able to, you know, continue creating that awareness and just presenting these numbers. You know, I was talking to a friend the other day and we were saying Kitambo, when the conversations around HIV were more about scaring people, people were actually more woke. And we don't want to go that direction, but is that the direction we have to take? And if so, then let's do it. I mean, right now we're talking about 500,000 teenage girls getting pregnant every year. Out of that, 13,000 are not able to go back to school. We have girls dropping out of school. Out of that number, we still don't know how many are accessing unsafe abortions and dying as a result of that. Other times we have this tendency where we have conversations from a silo. We talk about HIV as its own, we talk about teen pregnancies as its own, and we talk about unsafe abortions on its own. But we never think about the correlation between it. And even just to break out of this, we even talk about mental health. Is anybody thinking about this young 16, 15-year-old girl who's pregnant? Is anybody thinking about the boy who probably got this girl pregnant? So it's such a varied conversation, but we keep burying our heads in the sand, as you said, and talking about it in one phases, parallel phases, and it's not fair.
So how do we move this conversation from, you know, stopping to talk about, you know, just abstinence and, you know, realizing that this is here with us and we need to change this conversation? Yes,
so some of the different tactics we're using as Sauti Sasa is actually, I can base it on three things.
Yes.
Again, number one, we're looking at the community and how we can begin to have this community dialogue so that we can have community-driven and community-led solutions, because it's the community that knows what's happening. If I come from Mandera or Wajir or Kisumu or Mombasa, I know what's affecting me in the area that I'm in. So we're trying to just, you know, initiate that community-led sort of initiative in terms of ending teenage pregnancies and ending HIV infections.
The three-prong approach that you have towards trying to change the conversation from abstinence to doing something about it.
Yes, but even before I get into that, one of the things I'd like to bring out even from the story we just watched is how as a government or as a society we have become more reactive than proactive. So we react to situations. We hear teen pregnancies are happening, or it's on the rise, then we react, oh my God, what are we supposed to do? Nini, 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 and then all of a sudden the conversation stops, as opposed to being very proactive about it. Like, this is what we've had, how do we protect our future state from
Yes.
having something like that. For instance, if it was in the instance of that, these cases have been happening a lot around the ferry. So why is there no rescue services over there? So in the same case with this conversation is, why are we not, allowing that space for young people to be able to access these services? So back to the three things. Number one was talking about the community dialogues.
Yes.
Number two is we're looking at how we can be able to get political mileage in terms of just, enhancing this conversation further.
So you're talking about policy change. Or what do you mean by political mileage?
By political mileage, I'm looking at policy change has happened. For the longest time, we hear different policies are being implemented, are being passed, are being passed into bills and whatnot, but then the implementation bit is completely lacking, and the accountability mechanisms for it. And so by that, we're looking at, first of all, how policymakers are actually also influencers in communities. If an MP today was to decide that, teen pregnancies is an issue for me in my county, and I'm going to talk about it as much as possible, not in my locale, then I can actually, begin to change the mindset of the community. And so we're looking at how we can, change the mindsets of politicians to have these conversations. And we're going from the smallest level of the village elder,
Yes.
the MCA, to the MP, the senator, and even the governors, and even His Excellency the President, because as we may all know, he's actually currently the youth ambassador at the UN, the champion for youth issues.
Yes.
From the United Nations. And how can he, sort of continue to have these conversations from a wider audience, including the fact that the International Conference on Population Development will be happening in the country this year. And so how does he also take that stage to, get this conversation moving? And then finally, we're looking at how young people can actually be the drivers of this change, because at the end of the day, we are securing our own future. It's not the future.
But how many of them are willing to, even say that they have already made their sexual debut to get, that kind of help? Because many parents, if you ask them, they'll tell you, not my child, not yet.
And
we can't have this conversation now.
And that's the funny thing. If you take the conversation from the lens of the parents, then you're getting a totally different thing, as opposed to taking it from the lens of young people. And that's why, as you can see, I'm a young person. We're trying to use young people to get to young people, and just really increase the voices of young people, or give them a platform that they can actually be heard, because for the longest time, young people have always been seen as a taboo in society, a pain, like, oh, young people, you're always doing this and this and this. But then we've never looked at young people as collaborators in terms of getting solutions to these problems. And so we are trying to get it from that lens, where we can, leverage that voice of young people to be able to speak up, be heard, and, talk about teenage pregnancies, because we need to secure our future.
Okay. We've seen a push for sex education to be introduced in school. Do you think that it's going to be, to be helpful in terms of having this conversation out there?
I believe so, yes. But how we need to approach it is from the lens of stop looking at sex education as it has been advertised, which is sex education as something to, increase the promiscuity of young people. But look at it from the lens of, we try to call it sexual empowerment. And so in that sense, we're looking at it at how do we actually increase the knowledge and awareness of young people towards their sexual health and reproductive health and rights, so that as a young girl, you're able to negotiate for safer sex. As a young girl, you're able to understand about the aspects of saying no. And what a no is a no. You're able to be concise and very precise with your no. And even as for young men and boys to talk about how sexual autonomy for young girls needs to be respected.
Okay.
And so it's not our choice, it's their choice.
I'm just listening to you and imagining an African parent.
Going like, guy, what's happening? Mom and dad, I'm sorry.
All right, our time is up, but I just want to give you a moment to look into the camera and perhaps speak to the parents out there, especially those who still don't feel like it is time for us to have a conversation about, sex education with our children, or what you call sex empowerment.
Yes. Which camera am
Straight into the camera.
Yes.
Yeah.
I would like to say that it's time we stop living in sort of this cocoon of believing that young people are not aware. So many factors actually change the knowledge and perception and awareness that young people have: political, economical, societal, technological. And so we need to be able, especially for parents, to be able to sit young people on a table where we are, you know, sort of collaborators in this conversation. And so stop looking at your child as a pain or as a menace, but actually look at them as somebody you can have a conversation with, which is a very good example with me and my dad. We are the best of friends, and we're able to talk about so many things. Sometimes it may be uncomfortable, but you know, if it starts from the house, then it actually increases the self-awareness that young people have in terms of dealing with these things when it comes you know, when you go out to society. So don't leave them out to society, to their friends, to their peers, to Google and whatever. Just be there for your child.
I'm tempted to ask you how old you are.
I'm not old enough.
All right. Thank you, David. We really appreciate that the conversation is actually starting here, and continue doing what you're doing. Sauti Sasa campaign, just trying to get the information out there.
Yes.
That way we can be able to stop the number of teen pregnancies that we are seeing today. So
Yes,
thank you very much for your time and your insights.
Thank you so much for having me.
Well, we have been talking to David Rasheed, who is a champion for youth reproductive health care, just giving us some of the things that they're doing out there to try and get this conversation out. It is important for us to talk about the youth and reproductive health care, and particularly issues of access, which he says we talk more about the curative as opposed to the preventive. If we go in that direction, perhaps we'll not be talking about 500,000 pregnancies a year that is among our teenagers. This is where we put a cap on the show, but of course, business news is up next with Betty Kiptum.